Today we're going to be talking about elbows. E for elbow pain. Most elbow pain presents as medial elbow pain or lateral elbow pain. This can be medial epicondylitis or golfer's elbow, or lateral epicondylitis, which is tennis elbow. Now, you don't have to be a tennis player to get tennis elbow or a golfer to get golfer's elbow. Oftentimes, tennis players will also get or golfer's elbow, and oftentimes golfers will also get tennis elbow. So it's a little confusing. It's just based on the typical movement. So with golfing, we come in this way, so the stress gets put on the inside of the elbow. Whereas with tennis, when you do the backhand, the stress gets put on the outside or the lateral aspect of the elbow. So that's where those terms typically come from. Some common treatments that we do for medial and lateral elbow pain include laser therapy. The laser therapy is going to stimulate the mitochondria in the cell to help heal with any of the tissue. If there are micro tears with any of the fibers of the tendon or the muscle, it's going to help heal that quicker. It's also going to help push inflammation out of the area so that there's less pain in the area. We also will do cross-friction massage over the area or active muscle releases to help break up any scar tissue or trigger points and muscle adhesions that we see in the area. And then we also want to accompany strengthening exercises to the inside or the outside of the elbow to make sure that those muscles are strong enough to support any movements that you're doing on a regular basis. Along with treating the elbow, we want to make sure we actually figure out why you started to develop the elbow pain, whether it's on the inside or the outside. Oftentimes, there's a mechanic issue within the shoulders where it's not moving the way it should, so you start to compensate in the elbow, and your elbow starts working too hard because there's something going on with the shoulder where the muscles aren't working the way that it should. We will often do postural exercises as well as strengthening exercises around the shoulder and the rotator cuff, the upper back, and even into the mid back to make sure that that's working properly to eliminate anything from happening in the future. Another thing that we'll do is adjustments to the neck, the upper back, and sometimes even the shoulder and the elbow to make sure that those joints are moving the way that they should be. Lastly, one of the things we want to avoid is getting multiple injections, specifically corticosteroid injections in those areas to help with the pain or manage pain. If you get multiple corticosteroid injections anywhere in the body, it's actually going to start to degenerate the tissue a little bit more. So it's going to make the injury worse later on down the road. So there are other methods that we want to utilize before resorting to a corticosteroid injection.